Welcome to Be Livable. Dedicated to health condition awareness and holistic wellness, gastritis is characterized by inflammation or swelling of the stomach lining. This condition can lead to irritation of the stomach's inner surface. The stomach lining serves as a protective barrier composed of mucus that safeguards the stomach wall. Any weaknesses or injuries to this barrier can lead to damage and inflammation caused by digestive juices. Some individuals with gastritis may experience no apparent symptoms. Others may suffer from significant discomfort. Gastritis is a gut health condition that can arise from persistent inflammation, an inflammatory diet, excessive bacterial growth, autoimmune responses, specific medications, or various other factors. The symptoms associated with this condition can be quite distressing and may encompass abdominal pain, heartburn, bloating and heaviness, nausea and vomiting, decreased appetite, and weight loss. Gastritis may arise suddenly in an acute form. It encompasses different types, with acute gastritis characterized by severe episodes that may last for a day or two, while chronic gastritis can endure for months or years. Chronic gastritis poses a more significant risk, as it can lead to various complications if not addressed, including the development of stomach ulcers and stomach cancer. Atrophic gastritis represents a serious subtype of chronic gastritis, potentially resulting in the gradual loss of gastric glandular cells. Chronic atrophic gastritis may result in deficiencies of vitamin B12 and impaired iron absorption. Additionally, it can contribute to the risk of other nutritional deficiencies, including calcium, vitamin D, and vitamin C, due to reduced secretion of hydrochloric acid in the stomach. It can arise from the use of certain medications, the consumption of alcohol, stress-related conditions, exposure to radiation, and duodenal bile reflux. These factors may result in histological changes in the gastric mucosa, which are marked by low-grade inflammation. Chronic gastritis has the potential to intensify the overgrowth of Helicobacter pylori, or H. pylori. This bacterium tends to multiply in the mucus layer that coats the stomach lining and the duodenum. This bacterium releases an enzyme referred to as urease, which transforms urea into ammonia. The ammonia generated provides a protective barrier for the bacterium against the acidic conditions of the stomach. As H. pylori increases in number, it erodes the stomach tissue, potentially causing gastritis and gastric ulcers. Stress hormone cortisol notably enhances the secretion of gastric acid. It influences the gastrointestinal system by elevating cortisol levels, which in turn reduces the circulation of blood and oxygen to the stomach. Numerous over-the-counter and prescription medications, as well as dietary supplements, have the potential to induce gas and bloating. Prolonged use or excessive consumption of non-steroidal anti-inflammatory drugs may lead to irritation and damage to the stomach lining, resulting in gastritis. Imaging tests routinely used for the evaluation of gastric issues consist of the upper gastrointestinal test called as EGD or endoscopy, in addition to ultrasounds, MRIs, CT scans, and X-rays. For improved visualization of the gastrointestinal tract, a barium swallow or barium enema may be utilized in conjunction with an X-ray. Colonoscopy is a diagnostic procedure that allows for the examination of the interior of the large intestine, known as the colon. Various intestinal disorders exist, which can be categorized into infectious diseases, inflammatory bowel disease, IBD, and other classifications. This procedure enables the visualization of lesions linked to these conditions, as well as the identification of inflammation, ulcers, neoplasms, and instances of hemorrhage. The approach to treating acute gastritis is centered on alleviating the primary cause of the inflammation. This typically includes the use of proton pump inhibitors and antacids, along with the cessation of nonsteroidal anti-inflammatory medications. Maintaining a wholesome diet and a healthy lifestyle can bolster your well-being and lower your risk factors. Gastritis is a condition that is both preventable and treatable. Minimize or eliminate the consumption of alcohol, caffeine, carbonated beverages, and energy drinks. Eliminate acidic fruits such as oranges, lemons, and tomatoes, opting instead for fruits with lower acidity. Avoid spicy and high-fat foods, focusing on healthier fat sources like omega-3 fatty acids found in oily fish, selective nuts, and seeds. Eliminate red meat along with gluten and dairy products. Incorporate probiotics into the diet such as natural yogurt, sauerkraut, miso, kefir, tofu, tempeh, kimchi, and sourdough bread. Include fermentable fiber from lentils and other legumes, as well as carbohydrates with a low glycemic index derived from vegetables and whole grains. Include herbal decoctions with anti-inflammatory properties. Cold beverages can hinder digestion. Refrain from drinking immediately after meals. Eat at least 3 to 4 hours prior to bedtime. If you are seeking a personalized holistic consultation and customized plan, please reach out for more information.